Dissociative disorders is a mental state of disorientation with your surrounding. This may cause an impaired awareness with your actions, your thoughts, or your physical sensation. Often, you may be driving to a location and for a split second, you forget where you were going. Dissociative disorders, on the other hand, is a complex group of mental health conditions that causes a disruption or a disconnection in a person's thought, memory, identity, or consciousness. Dissociative disorders tend to happen due to trauma early in childhood, and it may persist onto adulthood. There are three different types of dissociative disorders, namely depersonalization, derealization, dissociative amnesia, and dissociative identity disorder, formerly known as multiple personality disorder. With depersonalization, derealization, the person experiences a detachment from themselves, known as depersonalization, or a detachment from their surrounding, known as derealization. This is somebody who sits and feels like they are watching themselves in a movie. They feel completely detached from themselves. It should also be noted that depersonalization, derealization is the least severe of the three types of dissociative disorders. Next, we have dissociative amnesia. With dissociative amnesia, we have a loss of memory. And there are four types of dissociative amnesias, mainly localized, generalized, continuous, and systematized dissociative amnesia. Localized dissociative amnesia is the most common, and it involves trouble recalling the traumatic event. Sometimes the person has trouble recalling years or months surrounding the traumatic incident. Next, we have generalized dissociative amnesia. With generalized dissociative amnesia, the person cannot remember any of their traumatic past, including non-traumatic events. That means the person has completely blocked out the specific timeline in their life. The onset may be sudden and it may be stress-induced. People who have generalized dissociative amnesia also experience dissociative fugue. This happens when somebody lost heavily engraved talents. For example, a pianist might forget or might not know how to play the piano, or a surgeon might not know how to operate on a patient anymore. With continuous dissociative amnesia, the person forgets each new event as it happens. They have trouble remembering or retaining information. In other words, we say their recent memory is impaired. They don't have an ability to remember information. You may be telling them something and they are forgetting it as you're telling them. With systematized dissociative amnesia, the person forgets category of information surrounding the trauma. This might be names of people, location, or places. They might forget that. The third type is dissociative identity disorder. With this type, the person takes on personalities or different traits of people. There are two types of dissociative identity disorder, mainly covert and overt dissociative identity disorder. With covert dissociative identity disorder, the person has a sudden and dramatic shift in how they perceive, think, and feel. This person takes on the characteristics of a complete different person. It may be an idol. For example, somebody might take the personality trait of Elvis Presley and may sometimes even feel like Elvis Presley is talking to them. The main difference here is that the person is aware that they are taking the personality of this person. The next type of dissociative identity disorder is overt dissociative identity disorder. This is when the person outright assumes like two or three different distinct personalities, or what we call alters. These personalities or alters might talk differently, they might have a different taste, they might have different political views, some of them might have a different age, gender, or nationality. It is very challenging and concerning because individuals who have overt personality dissociative identity disorder may engage in risky behavior or self-mutilation. Sometimes they may wake up and find themselves in different places that they have no knowledge of how they got there. There are various types of treatments when it comes to dissociative disorders. The goal of treatment for dissociative disorder is to help the individual integrate their various identities into a more cohesive sense of one. This typically involves trauma-based therapy such as EMDR or brain spotting. We may also prescribe medications such as antidepressants, anxiolytics, or antipsychotics to help manage the symptoms that come with these disorders. Other forms of therapy such as cognitive behavioral therapy and dialectical behavioral therapy may also help.